Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Tiny guardians. What are adenoids? Adenoids are small masses of tissue. They sit high up in the back of the nose, behind the nasal cavity. You can't see them by just looking in the mirror. Though unseen, they play a crucial role in our immune system, especially during childhood. Like security guards, adenoids trap germs. These germs enter through the nose and mouth. By trapping them, adenoids help prevent infections in the body. Adenoids are most active in this defense role during the early years of life. As we grow older, adenoids gradually shrink in size. By adulthood, they typically disappear almost entirely. While active, they serve as an important part of the lymphatic system. This system helps our bodies fight infection and maintain fluid balance. When adenoids grow too big, understanding the causes. Adenoids are meant to protect us, but sometimes they can become a problem themselves. This happens when they get enlarged or infected. Several factors can cause adenoid issues. The most common cause is infection. Bacteria and viruses can inflame adenoids, causing them to swell. This is especially common in children who are frequently exposed to germs. Allergies can also irritate adenoids, leading to enlargement. In some cases, children are born with enlarged adenoids. This is often due to genetics or prenatal factors. These children may experience symptoms from a very young age. Environmental irritants like smoke and pollution can also irritate and inflame adenoids. Recognizing the signs, symptoms of adenoid trouble. How do you know if your adenoids are causing problems? Several telltale signs can indicate enlarged or infected adenoids. One of the most common symptoms is difficulty breathing through the nose. Enlarged adenoids can block the nasal passages, making it hard to breathe comfortably. This nasal obstruction often leads to mouth breathing, especially during sleep. Children with enlarged adenoids may snore loudly and have restless sleep. They might also experience pauses in breathing, known as sleep apnea. Other symptoms include a stuffy or runny nose, frequent ear infections, and a nasal-sounding voice. Children may also complain of a sore throat, difficulty swallowing, and a feeling of fullness in the ears. Section 4. Seeking answers. Diagnosing adenoid issues. If you suspect your child has adenoid problems, it's important to consult a doctor. They will conduct a physical exam and ask about your child's medical history. The doctor will examine the child's ears, nose, and throat using a lighted instrument. To get a better view of the adenoids, the doctor may use a special mirror or a flexible endoscope. This allows them to see the size and condition of the adenoids. In some cases, imaging tests like X-rays or CT scans may be ordered. These imaging tests provide detailed pictures of the adenoids and surrounding structures. They help rule out other conditions and confirm the diagnosis. Based on the findings, the doctor will recommend the most appropriate treatment. Section 5. Treatment options. From watchful waiting to adenoidectomy. Treatment for adenoid problems varies depending on the severity of the condition. In mild cases, watchful waiting may be recommended. This involves monitoring the symptoms and providing supportive care. Antibiotics are often prescribed to treat bacterial infections that may be contributing to adenoid swelling. Nasal sprays or oral decongestants can help reduce inflammation and improve breathing. For allergies, antihistamines may be recommended to control allergic reactions. In cases where conservative treatments are ineffective or symptoms are severe, surgical removal of the adenoids, known as adenoidectomy, may be considered. This is typically an outpatient procedure performed under general anesthesia. Section 6. Prevention strategies. Keeping adenoids healthy. While not all adenoid problems are preventable, there are steps you can take to reduce your child's risk. One of the most important is practicing good hygiene. Encourage frequent hand washing, especially before meals and after using the bathroom. Teach children to cover their mouths and noses when coughing or sneezing. Avoid close contact with people who are sick. Maintaining a healthy lifestyle can also strengthen the immune system and reduce the likelihood of infections. Ensure your child eats a balanced diet, gets enough sleep, and engages in regular physical activity. Vaccination is another crucial aspect of prevention. Make sure your child is up to date on their vaccinations, including those that protect against common childhood illnesses. UMCC, your ultimate medical consultant connector.